Welcome to Integrative Connections podcast. I am Kaela McGuire.
I'm Dr. Angie Stamm.
And we are here to talk today about arthritis. It's a pretty common topic, especially in aging pups. And so I'm excited to learn today how I can help my dog live the longest and healthiest life.
Yeah, thanks, Kaela. Yeah, we're super excited to share with you our community of integrative health topics for pets and people. And as a holistic veterinarian with 25 years of experience, I've had lots of time to learn about the best ways to manage osteoarthritis in cats and dogs and horses too, actually.
Yeah, I imagine.
So we thought we would go through some different topics with you today.
Yeah. So Darsh is going to be 10 this year, and he's incredibly active. And I went in and had him all checked out recently, and I know that you guys heard a little crackling in one of his legs, and so you gave me an injection.
So what we gave Darshan was some Attaquan, which is an injectable form of glucosamine, essentially. So it's marketed to look like a pharmaceutical. I think maybe so the Western vets will be happy with it or whatever, but it's really just an injectable form of glucosamine. And when you're injecting it, you're getting their blood levels that much higher than when you could achieve orally. So a lot of people think, well, oral glucosamine may or may not be effective depending on, the individual, but with the injectable, we see much more profound effects. So if clients are comfortable doing the injections or bringing the dogs in for the injections, it's really more bang for your buck.
Okay.
It's going to be much more profound healing for the joint. What it does, it's actually an extract of bovine tracheal cartilage, and it actually gets it prevents degrading of the existing cartilage and actually can promote healthy cartilage regrowth.
Oh, wow.
Yeah.
Okay.
Super safe, very low risk of side effect. Sometimes you can't, if you give too much of it, you could have an increased risk of bleeding, can have a slight blood thinning effect.
Gotcha.
Other than that, it's extremely safe. It's only labeled for use in horses and dogs, but we do use it off-label in cats also with good success. So
interesting. And what about humans? I'm sure a lot of you are wondering.
So there's nothing FDA approved in the US, but in other countries, I think Australia has something called Cartrophin, which is pentosan, which is similar.
Okay.
So depending on which country you're in.
Gotcha.
We may have to go to Australia and check it out.
I'm down. Let's make a trip.
Yeah.
So what are the reasons that animals typically get arthritis? What are the most common reasons?
They can be born with a misshapen joint. So you hear about hip dysplasia or elbow dysplasia. That just means that the joint is formed incorrectly and there's not good symmetry. So you're already starting off from birth with an asymmetrical joint that's unbalanced and loose.
Oh, wow.
So you have laxity or it's unbalanced. And so you're already starting off eroding that cartilage right away.
Okay.
And then that's going to be, they're going to get arthritis no matter what you do with that. But there's things that you can do like the Attaquan and other things that we'll talk about that will slow that progression way down.
Okay.
The other common thing that we see is injuries. So they get hit by a car, they have a fall, something like that. And usually with those, what happens is they tear or weaken the ligaments that are supporting the joint. And when you weaken ligaments or stretch them out, now you have that same instability that you had with a dysplastic dog, where the cartilage is now getting rubbed and degraded faster.
Oh, wow.
And creates inflammation.
That
and
makes
then,
sense.
the body's laying down bone to try to stabilize it, and it gets thickened and crunchy and all of that.
Yeah.
You can also have what's common in dogs called a cruciate ligament rupture, which is a soft tissue injury, and that predisposes to osteoarthritis because, again, you've got ligament laxity and then more movement than you should have in that joint. And then overuse injuries, I guess that's the same, more of a chronic low-grade trauma. Dogs that are frisbee or ball players, and they just really overuse those joints, just like people who overdo it in certain sports.
Yeah, and I imagine stairs probably.
Yeah, and you can have autoimmune causes or infectious causes of joint disease in dogs and cats too, but those are less common than the congenital and traumatic forms.
So I would imagine weight will contribute to arthritis. How accurate is that?
Absolutely. Just like in people, the BMI, higher BMIs correlate to more inflammation. I think there's a little bit of a myth that, oh, well, excess weight just puts more weight on the joints, and so that
Right.
wears them out faster. I think that's probably true, but what's actually more profoundly true is that extra body weight, extra body fat is actually a metabolically active organ that creates its own inflammation.
Oh, wow.
So it's inflammatory. And then the joints are more inflamed and the cartilage gets degraded faster.
Wow, that totally makes sense. You guys mentioned another treatment option for Darsh. Wasn't prolotherapy?
Prolotherapy
It was. Okay.
Prolotherapy is an injection technique that was invented in the 1950s by actually an MD in the human world. And it's not widely done in both the human or veterinary world, but it is still around, and it's what I call kind of the old school regenerative medicine technique before we had stem cells and PRP and all these more expensive regenerative medicine techniques. There was prolotherapy, and essentially what it is injecting dextrose or sterile sugar into the ligaments around an unstable joint to tighten them down and create some stability so you're not getting all that inflammation and excess movement.
Okay. And what's PRP? That sounds familiar.
That's platelet-rich plasma, and that's a blood product that is injected into the joint to stimulate the body's own repair mechanism.
I think that's also what you recommended to me for him.
Yes.
Okay. All right, it's on the list.
Yes, we have, and it's certainly really basic things like acupuncture, chiropractic, laser therapy. Those are all much more commonly used for managing osteoarthritis, but just depending on what your veterinarian offers, there's so many options. But I think the most profound would be anti-inflammatory diet, which we could talk about.
Yeah.
The injectable glucosamines, very good bang for your buck, and high dose fish oil if they'll tolerate that.
Okay.
High dose omega-3s if they'll tolerate it.
And a couple remedies that I'm wondering just every day would be red light therapy and castor oil. Would those work?
Yeah, I think red light therapy is great for improving inflammation and blood flow. And castor oil I don't have a lot of experience with, but I know it can have anti-inflammatory effects as well.
Okay. Little puppy castor oil pack.
Totally. And with regard to the anti-inflammatory diet, that's a pretty big one. I mean, if I had to say, if you came to me and you said I only have a limited budget to manage my dog's arthritis, and certainly if the dog's in a lot of pain, I'll use Western pain meds if they need it, or herbal pain meds. But we really have to look at the diet as a foundational treatment. If you're feeding an inflammatory diet, everything else that we do is not going to work as well.
Right.
Right. So what is that?
It's a domino effect.
Right. So what is an inflammatory diet versus anti-inflammatory diet? Well, a kibble that's cooked at a high temperature and has a lot of carbs is super inflammatory. And over time, over the dog's lifetime or cat's lifetime, that puts them more prone to joint inflammation and arthritis.
Wow.
So you can look at it as a therapeutic, or you can look at it as a preventative.
Food is medicine.
It is. But if you, even as a young animal, if you kind of reduce or eliminate the dry kibble in their diet, that's going to really put them at a better spot when they're older in terms of their joint health.
And we just did a full episode about diet, but just anti-inflammatory diet in a nutshell. What would be your key basic ingredients?
Fresh or low heat processed, not excess, no excess carbohydrates, healthy fats, and that's it.
Okay. I like it. And you don't need any fancy custom recipe. There's so many options available today. Right.
Yeah, I mean, a lot of my clients do really enjoy home cooking for their pets, and there's a lot of options out there to help them balance if they want to purchase a product that is like a pre-mix, so they can just add the meat, a hybrid. That works well. Or you could do, if you can't afford to do all fresh, maybe do a high quality kibble dry food as the base. Try to avoid the nightshades like potatoes as a base for that, because that can be inflammatory for joints as well. And then you could use some commercial raw or commercial freeze dried or commercial lightly cooked that's balanced for you, and that's gonna go a long way in terms of their joint health over time.
Shakti, when she was a puppy and I was trying to figure out, diet ultimately healed her, but when I was kind of trial and erroring her diet, I had a vet tell me chicken and potato, and it did not help, and now I am realizing why, because it was just keeping her inflamed.
Yeah,
Interesting.
absolutely. Especially the chicken.
Yeah. And the potato, it sounds like.
Potentially, yeah.
Like, thanks, Matt. Good thing I found you. Little plug there. No, I'm teasing. So you do telemedicine if somebody's not local and they have some more questions, more specific questions for their pup.
Absolutely. Yep. We do telemedicine. We have to have an in-person client-patient relationship in order to prescribe pharmaceutical medications, but gotcha. For supplements and diet, we can do that via telemedicine.
What are some supplements? You gave me Ligaplex.
Yeah, that's standard process Ligaplex. That is a whole food vitamin mineral support for the ligaments. It's actually a human product. I've taken it when I have a little sprain or strain.
Oh, interesting.
But it's high in manganese, and manganese is a mineral that that ligaments and tendons need to stay healthy. And one of the reasons that that we have a lot of ligament issues in our pets is, I believe, the high glyphosate levels in the food supply. That manganese and other minerals are really, the absorption of those are really reduced by the presence of glyphosate in the gut. So we have actually an epidemic of cranial or cruciate ligament problems in dogs now, which we didn't have 40 years ago. And I kind of attribute that to the glyphosate and the mineral deficiencies that's causing, weakening the ligaments. That's my theory. It's not been scientifically proven, but Ligaplex is one that we use a lot for ligament laxity or cruciate ligament tears in dogs. It really helps to tighten things up. And then we use a lot of fish oils, omega-3 fats as well for treating osteoarthritis. And interestingly, dogs and cats can't convert plant-based omega-3s into the bioavailable form very efficiently. So you can use things like flax and hemp oils, but they're not going to be as therapeutic as going to an algae or a fish base. And so we use a lot of Nordic Naturals, omega-3 PET, which is a very high concentrate oil, and it's got a lot of EPA and DHA per volume. Colorado State recently they publish a dosing guide for fish oil for treating osteoarthritis in dogs, and so you can find that online, but it's quite high. The dosing is quite high. So for example, a 100-pound German Shepherd could take up to 4 teaspoons of fish oil a day. Wow. if they'll tolerate that gut wise. So you really have to use a high dose of fish oil. Usually I find that people that are using fish oil are underdosing it.
And something that we're striving to accomplish here with Integrative Connections is finding products and supplements that both pets and humans can use and benefit from, and different wellness techniques. And this is a perfect example of that.
Yeah, and just looking at the intersection of holistic health for pets and people, maybe collaborating with other practitioners that on the human side that maybe have something to teach the veterinary side potentially. Absolutely, or vice versa. Yeah. There's some great prolotherapy doctors on the human side that maybe could help us learn more about that technique for pets. That's very accessible and inexpensive. And I've had some great success with that. So yeah.
Can you tell us a story?
Prolotherapy, what I use it most for is partial cruciate ligament tears in dogs, where they all of a sudden they're limping, they go to the vet says, oh, you need surgery. Owner says, well, I don't really have $5,000 for a TPLO surgery. and the dog is older, and or the dog is older and they don't want to put it through the surgery. It is kind of a major surgery. So especially for partial tears, we've had dozens of dogs recover well from that with just prolotherapy. But it does take a series of treatments, usually 3 to 5 treatments spaced about a month apart.
Okay.
And each time we're kind of injecting and tightening those ligaments and creating more and more stability. They can still get secondary arthritis, but they can still get secondary arthritis when they get TPLOs too. So it's not always, it's often not perfect either way. So it is nice to have that non-surgical option. And then we often stack that prolotherapy treatment with things like stem cells or ozone or spring, which is an injection of hyaluronic acid hydrogel into the joint. So shockwave therapy, which creates blood flow and releases stem cells to the area. So there's lots of synergies between the different therapies. But so it's nice to have those other tools than just either surgery or pain meds.
Oh, 100%.
Yeah.
Most of those I've heard of for people. Is shockwave therapy something for people too?
Yes. The podiatrists use it a lot for plantar fasciitis.
Okay.
It's used for lithotripsy, breaking up kidney stones in people.
Okay.
Ultrasound guided lithotripsy. And I think the sports medicine people certainly use it for a variety of things, but that'd be something that we can explore more.
Yeah, absolutely.
Yeah. It hurts though.
Oh, I imagine. Oh my gosh.
Painful.
I mean, it's in the name, shockwave.
It hurts. We sedate the dogs and cats for it, and the horses.
I'm sure they appreciate
They
that.
get sedated for it, yeah.
Yeah.
But they don't sedate the people who have to suffer.
Like, well, get what you pay for. Get more bang for your buck, no pun intended.
Yeah. But I do think also as a preventative strategy for arthritis and ligament tears and things like that, chiropractic. I mean, it's or basic bodywork, chiropractic, massage, acupuncture, getting the muscles balanced, because if you have chronic tension in the spine, that's going to throw off the gate, and then they're going to overstress certain limbs or certain joints in an unbalanced way, and that's what can lead to these ligament tears or arthritis. So as a preventative measure, the diet, the healthy fats, and then maybe investing in some body work, especially if you have a really active animal that's doing the dog sports and the equine sports. People know this already, but for the general pet owners, investing in just a little bit of body work, it doesn't have to be that often, quarterly or a couple times a year, just to kind of get the body balance, because that really helps with the functional movement, and then that creates less stress on the joints too.
That was my first indication that something was going on with him, was when I was rubbing his hips. He was just like, thank you, keep going. And he's never really responded like that. And like I said, he's getting older, and I imagine that, massage feels a lot better when you have some work that needs to be done. Massage will always feel good, but especially when your owner is recognizing that.
And maybe we can do some pet massage courses or videos so that people can do it at home and really be able to tap into where their animal might be having some early issues too.
Yeah, absolutely. And acupressure, I want to do a little bit more in depth about that, but what are some quick little
acupressure points?
Yeah.
So we could demonstrate on Speedo or Darsh if you want. This is the aspirin point. That's a good one. It's easy for people to find.
Can you do it on that one?
Yeah, we can do the aspirin point. We can do liver 3, stagnation point. We can do the back shoe points. These are always get tight in dogs. And then I can think about it even like the chakra points. So like, the chakra, calming points.
Okay.
Large intestine 1 be here. So when you're touching your dog's back and joints, where I tend to find a lot of soreness, I'm going to put him on my legs. So they all get sore on the sides of their neck. So if you just go in along here, just like us, these muscles going down into the shoulders, and kind of gently massage that, you can sometimes feel some big knots in there, and they might even wince a little bit. And that's how you know that it might have some neck pain. And you can do some light, gentle massage on those, just like you would for us. As long as they are good with it. And there's some acupressure points here too for calming right behind the ears. You fall into a little hole right behind the ears, and that's a good calming point. And also right on the top of the head, when with that little bone that sticks out is a good calming point as well. Then you can feel along the spine and feel for any tender points there. These are all acupressure points too, so if you feel a tender spot, you can just do some light pressure there for about 30 seconds to a minute, and it'll help release that muscle spasm. And feel down the outside of their leg to see, and the front of their thigh, the back of their thighs, see if you feel any tight muscles there, any soreness. We'll go more into depth into acupressure points going forward in another episode, but that just gives you a general way to kind of feel into their muscles and see if they have any tight spots.
What are your favorite herbal or natural remedies for joint pain?
The simplest would be arnica, which is homeopathic remedy that
I've only heard of that for humans.
Regular people aren't human. Arnica is the same.
Okay.
Systemic enzymes like wobenzyme. I don't know if you've heard of those, but it's kind of like the same idea as digestive enzymes, but you take them in between meals on an empty stomach, and it will actually help to break down some of the inflammatory compounds in the tissues. It can reduce inflammation.
For humans too? Mm-hmm. Oh, okay. Yeah. That's on the list.
Yep. And then of course CBD is widely used in veterinary medicine just like it is in humans, and that can be super helpful for, you can use it topically as well as orally for inflammation and calming. Can be more an expensive therapy, especially if you're getting into the higher doses for a big dog.
Yeah.
But I do like it a lot. Turmeric, Boswellia, those are some pretty big herbs for inflammation as well.
Okay.
Boswellia especially.
What's Boswellia? I've never heard of that.
That is frankincense.
Oh, no way. Mm-hmm. Wow.
Yeah.
It's good for fine lines and wrinkles mixed with castor oil too.
There you go.
Just a little side note.
So that could be used topically onto a joint, or it could be taken internally.
Oh, wow. Okay. Very cool.
Yeah.
And I just want to ask real quick about humic fulvic, because you've been talking a lot about glyphosate being a cause to the inflammation and gut health and all of that, which trickles down into arthritis.
Yeah.
So humic fulvic will detox that from the gut, is that right?
It's a binder. It's a detoxification mineral. So it's a soil-based mineral that actually binds glyphosate and heavy metals from the gut, which is going to reduce the ligament or the mineral deficiencies, which is going to improve ligament health. And if your ligaments are healthy, they won't stretch out and get loose and put more stress on your joints.
And that's the whole holistic health picture.
That's right.
Love that. All right. So I think we covered quite a bit.
There's certainly a host of Western pharmaceuticals that we can use for the more advanced cases, and I'm not shy about using those as well if we need them.
There's a time and a place for them.
Time and a place for those, but of course, we usually use a blend of different modalities depending on the owner's budget and the severity of the condition. So yeah.
Awesome. Well, thank you.
Thank you.
Thanks for joining us, and we'll see you on the next episode.